Welcome to the Metabolic Health Docs YouTube channel. I am so happy you have come to this video today. And today is a little bit about making a confession, guys. So many people who have learned the value of lifestyle changes didn't really realize it until maybe they had a personal struggle or they saw a patient who taught them, like Dr. Eric Westman, a patient taught him that low carb was the path to healing. And many of us feel kind of bad. We go back and we think about the things that we taught our patients in the past, and we feel bad about that because could I have helped somebody 10 years ago, 20 years ago that I didn't help? So today I want to bring a good friend, an endocrinologist who is also feeling a little sad about the past and wanted to do a little bit of a confession. And that endocrinologist is Dr. Sanghani, who does great work in India. She also previously worked in my healthcare system before she went back to India. So, Doc, man, we have to sometimes look in the mirror and say, man, we didn't know what we were talking about back then. But what's your thoughts?
Yeah.
What emotions come to mind when you think about what you did in the past versus what you do now?
Yeah. No, it's good. It's right. It's right. It's good to hold up that mirror to ourselves. And I think we have to agree that we're people of science. And if we're people of science, we need to evolve. I can't be just saying what I said when I graduated because we're looking at a 40, 50-year long career. Are we really thinking that what we learned 20 years ago, 50 years ago is going to be current as we age? And so, yes, I think there's that sense of regret and patients say it too, right? Is if I meet somebody now and they're like, but doc, I wish I had seen you 10 years ago. And I was like, I wasn't me 10 years ago. I was writing those prescriptions. So I have compassion for other physicians who are writing them now because I was that person.
Right. That's right.
And I had ideas, but I didn't know how to act on it.
Mhm.
And, I look at my old prescriptions and I'm like, oh man, I stopped writing that medicine a long time ago. I haven't prescribed that in years. Or, oh, I told this person to start insulin. I really shouldn't have done that. I should have clarified their options for them. So you do that, and then you have to have compassion, right? Because otherwise we would burn out. And endocrinologists actually have extremely high burnout rates. Um, yeah, it's really tiring, sometimes. And so you need to have compassion for your mental health
Mhm.
and forgive yourself and be honest. Look, I didn't ever mean to do harm. I was following what the evidence and the guidelines told me to do. I had conditioning and blinders on, and I'm willing to see the light. If I learn a better way of doing something, let's do that.
Yeah, and I want to say for those doctors who are not in front of this camera like we are, I want to give them grace because the training that they had did not teach them that lifestyle medicine was the secret. They didn't learn anything about metabolic health. And so give them grace. And hopefully, as we evangelize this message through the masses, more doctors will learn. The Society of Metabolic Health Practitioners has a journal now, which is
Yeah.
so exciting. So now we have a organization who's focused on metabolic health with a journal, and they have a list of doctors that you can find throughout the country if you do a doctor search. And hopefully, we will also have a metabolic specialty that we can then lean on, not just in the United States, but in India and throughout the world. So as we apologize for not knowing what we didn't know back in the day, we want to also celebrate the fact that we now know that metabolic health can be achieved through lifestyle. And we have great doctors like my friend who will help lead the way. So thank you, Doc, for coming to this video, doing a confession, showing us your heart. And I also want to thank you for coming to the Protecting Your Nest podcast, where we talk more about how lifestyle is the key to reversing so-called chronic medical conditions like diabetes. So thank you for coming to this video. And until the next video, continue to be safe, be well, and continue to protect your nest.